shocking truth about female genital mutilation that will shock you. And before we look into those, or before we go deep into those shocking truth, there was a friend who told me that in their community they usually practice female genital mutilation or FGM because they believe that if a girl does not have a female FGM, or if a girl doesn't experience FGM, this girl will sleep with so many men before they get married. So they do FGM, or they practice FGM because they want to reduce the sexual urge for girls in their community. So a girl is not supposed to have sex before marriage, and for them to avoid this, they do, or they practice female genital mutilation or FGM. Let us look at what is FGM. Is partial or total removal of the labia minora, the labia minora and majora, and the clitoris, and sometimes it involved sectioning, piercing, and creating even extra space or reducing the size of the vagina. Some community practice FGM because they don't want girls to have sex before marriage. Some community practice this procedure because they believe it is a rite of passage, and therefore girls should practice it, or the girls should pass through the procedure for them to get to the next stage. I don't know what religion consider it, but what religion discourage female genital mutilation. I want to tell you that female genital mutilation or FGM doesn't have health benefit. Instead, it causes harm. It causes physical harm. It causes emotional harm. Now, why do World Health Organization and other non-governmental agencies refuse or discourage female genital mutilation? This is because it doesn't have health benefit to a woman. Female genital mutilation doesn't have health benefit to a woman. So let us look at some of the complication, immediate complication and long-term complication, that if you do or if you practice this a procedure, it will cause the complication that will come after the procedure. So number one, we are going to start with immediate complication. So number one is severe pain. If you cut someone, obviously this person will experience severe pain. Number two, excessive bleeding or hemorrhage. Of course, you've cut someone, this person must bleed, and the bleeding can be severe. So number two, it will cause excessive bleeding. Number three, this person can have pain until the person experiences shock or goes to shock. So the next point is shock. And number four, swelling on genital issues. This one will happen without any explanation. Urine retention, because you are interfering with God's creation, so the person will experience that. Another one is infection, because even the procedure is not sterile. The procedure is done while hiding, because you know the consequences. The procedure, the things that they are using to do the procedure are not even new. They are being reused. They are not even practicing infection prevention. So automatically infection will set in. Also, the person can experience injury to the surrounding of the place. And another one, the person will experience dislocation, because sometimes they attempt to reposition the vagina. And also, in rare cases, someone can die. So what are the long-term complications? This long-term complication occurs after months, after years, after the procedure. So number one, chronic pelvic pain. Someone will be experiencing chronic pelvic pain because maybe this person experienced infection that was not treated, and also the place was not even properly healed. So you will get that the person, or a girl or a woman, is experiencing a chronic pelvic pain. Number two, UTI. This person will have a recurrent UTI. Most of the people who are getting a recurrent UTI have done female genital mutilation. Some people can also get kidney damage in severe cases due to obstruction of urine, and also menstruation problem. And you will get that when a girl is menstruating, because sometimes they seal the place, so menstruation will be painful because they've blocked the flow. Another thing is also obstetric complication, where that when a woman is giving birth will experience prolonged labor, tears, postpartum hemorrhage, risk of stillbirth, and even obstetric fistula. I will tell you the reason why they will get obstetric fistula in the next video. Another one, also the person can experience infertility because of the blockage of reproductive organ, because you interfere with the place. So the person can get infection, and after long period of time they can experience a blockage of urinary tract, not urinary tract, urinary tract infection, reproductive tract blockage because of the infection. Also, the person will get keloids and scarring, which are not something beautiful, and also pain during urination, pain during menstruation, pain during sexual intercourse, reduction of sexual desire or sexual satisfaction. Those who have undergone an FGM never get orgasm. What are the psychological complications that might set in? Post-traumatic stress disorder. This person can have post-traumatic stress disorder. This person can have anxiety. This person can have stress. Person can have low self-esteem. This person can have nightmare related to the trauma. Now, what are the social complications that will set in? Marital problem. There are some communities, or someone will not, a girl, someone can refuse to marry a girl because that person, that girl went for FGM. So they can get that they can face that a lot. Also, painful infertility because of the blockage. Also, this person can feel isolation because sometimes they feel different from other girls, and they can experience stigmatization in the community, which does not practice that procedure. So as I'm finishing this video, female genital mutilation or mutilation, I don't know how to pronounce it, or FGM is deeply harmful practice, short-term and long-term consequences. So it can cause immediate complication, it can cause long-term complication. So I should insist, or I'm insisting that if you know you're practicing female genital mutilation, please don't do it, because it doesn't have any health benefits. It is not like male circumcision. This is just something interfere with female genital organ, and it has a lot of risk than benefit. I don't know even if there is benefit. Maybe if I do research, but I don't know if there is benefit. All those benefits that they usually say, those are just assumptions. It's not supposed to be done. So if your community is practicing this procedure, kindly run. Go and report those people. If you know someone who is doing that practice right now, go and report them to the nearest police station, because it is violation of right, human right. It is a violation of right. So if you find this video useful, kindly subscribe, like the video, share, comment. Don't forget to turn the notification bell so that every time I post a video, you will be the first person to be notified.